The issue of SCI units started to be dealt with during Minister Zajac's. In the official journal there was even a guideline, however it was not implemented, and this was in 2006. So before that there was some development already. There will be an anniversary soon, the 20th anniversary, and I hope until that time we will be able to do something with these SCI units. In that time we have had 10 different ministers of healthcare, including the current one, and 2 of them were delegated prime ministers or some other ministers. So we know what we are discussing. Sometimes I feel that we are talking to people who do understand human speech, who are looking for ways how not to implement something for people who need the assistance urgently. And I've been telling Jan Riapos that I really respect people like you, who are active. Some do sports, some are Paralympians as well, but we need the power, the emotion, and the enthusiasm of these 10 to 15% of people would be spread in the society to create conditions for the 85% who cannot do this because nobody helps them. And you will see this also in my presentation, why this is not helpful for them. This is the current situation in Slovakia in terms of a spinal patient. If you think that these are stairs to the Ministry of Healthcare, no, so that I don't get into some kind of trouble. In Europe, according to ESCIF data, there is roughly 11,000 new cases with the average age of 33 years. 40 to 50 come from traffic accidents, and they in civilized Europe, these patients live to the average age, to their average life expectancy. The number of accidents over the last years has been getting to balance with other reasons like tumors, post-surgery conditions, some inflammations, and so on. So this is not only about injuries. In Europe, there are around 60 SCI units. The number in Slovakia is 0. What are we discussing? This is very known to you, perhaps, and we are talking about paraplegic, tetraplegic, or pentaplegic patients, depending on the SCI level. We are speaking about people who need health care, rehabilitation, personal care. These are patients who lost labor productivity, they are disabled, they are in social isolation, also under stress, and they have many secondary complications. We know this, everybody in the world knows this, we are presenting this, but this doesn't get to the right places in Slovakia. As an example, what the information about patients with injuries have urgent surgical care for injuries in 2015. Spine is there only. So there is an organ which holds our body, but there is nothing about spinal cord injury, about spinal cord roots and so on. So these numbers are designed to help people in the ministry to do something for the people, but they don't have the necessary data because the Ministry of Healthcare or the Ministry of Social Affairs have no idea how many people are disabled, how many people are wheelchair users within the Slovak Republic. As an example, what we follow, we see some damages to forearms, wrists. We even have abdomen and the pelvis. This might include the spine, but this is an important information. We know very well what's happening and what the number of patients is, but we have insufficiencies in basic things. We don't have the data, we don't have the information about what kind of patients we have. The same applies for year 2007. We cannot draw any conclusions from this. In 2010 and 2011, we performed a survey of patients who were admitted to hospital care in the National Rehabilitation Center in Kováčova. Of course, this does not reflect the whole spectrum of patients in Slovakia. These are only patients who got to Kováčova and were there. You see, this is 78 patients per year with a spinal cord injury. Most of them had a spinal cord injury, and also most of them had serious neurological deficiency. So this is what we got from the health documentation and phone calls with the patients. In Europe, there are stages of complex care for SCI patients. We are on the ESCIF forum, so we are talking about the emergency or urgent, acute phase, primary rehabilitation, continual care, reintegration, long-term consultation activities, rehabilitation periods, and rehospitalization when necessary. So what is the situation in Slovakia? What's working well is the network of emergencies. They even know where to bring a patient with a spine injury. Spondylosurgical units are also working well because we have a network of these who are able to treat injuries very well. We don't have any SCI units, not even a single bed. Then in the rehabilitation phase, there is the National Center in Kováčova, but they do not provide care on the level of the EU standards and norms. So if we have a look at the indication spectrum, there are patients who shouldn't be there, and it's useless that they are there, because if they have, for example, hemiparesis or some other conditions in the National Rehabilitation Center, this makes no sense. The center was intended for spinal patients. It lost the narrow spectrum of indications, and the situation currently is that we treat anybody basically, and paraplegic patients, wheelchair users, we only give them 6 weeks for treatment in the National Center in Kováčova. This is what the health insurance company pays for. So this is the current situation. Of course, the recondition stays were stopped. In the past, this was the norm, but this is just rather an exception today. And the outpatient care here is not connected to SCI. They are looking for some people who they know, and they are looking for assistance for someone who would understand their problems, which is quite complicated because the issues of the paraplegic or tetraplegic patients is quite complex also in terms of medical disciplines. So we can state that there is one link missing, and that is between the spondylosurgical units and the National Center. Those are SCI units, and what we lack is a long-term care for the spinal patient. So the urgent phase is basically okay. We are doing everything within the optimization of the network of hospitals to even improve this, including the furnishings and equipment. Then the patient in the anesthesiological units or in intensive care units and so on, if they get bed ulcers, then big problems start. So the positioning is important. We keep stressing this, but again, the people who should hear that do not listen to us. There is no phase for the SCI unit. We think that the patients should stay there from the second until the 12th week before they are moved to the National Rehabilitation Center, and we are doing everything to reach this goal. In the past, during a different ministry, we already had some specific plans. This was what it was supposed to look like. So this is not some kind of sci-fi from some literature abroad. This is from the southwestern Slovakia. We had a project, but then the new wave came, the new director. Unfortunately, my pupil, my student, who said we don't need this. We already had the documentation for the construction. So this is what's the result. But we got out of the depression. We told ourselves that already Ludovic Tur said that there is no way back, we have to move forward. I would like to thank Jan Riapoš that he basically encouraged us, because without him I wouldn't manage after so many years. So we decided that we will move in various directions, and that is working on the methodological guideline of the complex care for a spinal patient in the Slovak Republic, standard treatment procedures, within the categorization of inpatient care, including SCI units and spinal reapplication units into follow-up care, within spondylosurgery, again equipping departments so that the care for the spinal patient is adequate, then elaborating a project of building SCI units within the recovery and resilience plan, and then drawing up methodological guidelines in detail for spinal cord injury unit and SCI rehabilitation unit. This is what we adopted as our task in April. The standard treatment procedures were adopted for a complex treatment for a patient with SCI. In the post-acute phase, this will be published in the official journal soon. This is based on the international documentation which goes with a spinal patient. These are standards. The rest of the world was in this stage already in the last century. We are dealing with the urgent phase as well. This is quite natural. Then we have the acute phase in the post-surgery department as well. We deal with the subacute phase, the stabilization rehabilitation phase in the SCI unit. We still have to work on building those units. It is determined what the activities there should be. Then we have the rehabilitation step. What's very important is that paraplegics should be in the National Rehabilitation Center for 5 months and tetraplegics for 6 months. We also have the inpatient care, repeated inpatient care for 6 weeks, 2 years after the injury, and then every 2 years, 5 weeks. This was not done in the previous years. And the last phase is the long-term outpatient care. Our intention is that the SCI unit would also have an outpatient section that would deal with the patient. This will be some kind of a lighthouse for patients who need the care, so that they can come into the spinal care for the SCI unit, which will be located regionally, and the SCI unit will manage their treatment with experts who are educated in these, including urology, gynecology, orthopedics, nutrition, and all the whole spectrum of problems that can come about as secondary complications with a paraplegic or tetraplegic patients. So our vision is clear. We want to construct and build SCI units. So that the National Rehabilitation Center and the SCI unit reach the standards of the EU. Then the long-term care, the recondition care is also included, and we want to also organize the outpatient part of SCI units. This is our vision. The current minister, when we discussed with him, he said that you don't have to convince me, just do it, and we are supported by the minister and his structures so that we can reach some kind of a conclusion. So I hope we will be successful. So just as an example, what we want to do is build SCI units. This is what's the current situation, and the green columns are the visions. So we really want to improve the follow-up care for paraplegic and tetraplegic patients. What's important currently, during the negotiations, there was a final meeting of the Categorization Commission for follow-up care, where we also have the spinal patient pathway. It's quite clear that from the spondylosurgical unit, the patient should go to the SCI unit, then to the rehabilitation center, and then regional individual care, but they always have the opportunity to return to the National Rehabilitation Center or to the SCI unit if there are some complications. This will be on the level of the 4th or 5th level hospitals. We have some agreement with the directors of these facilities that this should be in Bratislava, Banská Bystrica, Ružomberok, and Košice. So we already know what the equipment should be. Of course, we are talking about equipment that's adequate to the current period, including robotic neurorehabilitation. We take no compromises. For the whole Slovakia, this is roughly 30 million euros, which is really a small sum compared to what we hear in the television, the millions and hundreds of millions that the politicians operate with. So I think we should do something with the money for people who need our help. To conclude, I would like to say that, not to be pessimistic perhaps, we have complex care for the spinal patient, which is already closed, published in the official journal. We have finished with the follow-up care within the optimization of the hospital network, which will be in effect since the 1st January 2024. And we also have some progress in the spondylo surgery, and we are working on constructing SCI units and the methodological guidelines for those. So we may be optimistic to a point. I hope we will be successful this time, and let's hope this will not end up as the SCI unit in Nové Zámky. So thank you for your attention. Professor, you can still hold on to the mic. We still have some time left.
Who else are the cheerleaders of this project? Are you alone? No, I'm not alone. I have already mentioned Dr. Japoš, and we have put together an analytic team of analysts. So it's a joint program. So what I really appreciate about my colleagues is that we managed to convince them, because it's when they work on this, they may do this analysis. There is always this prism. So we visited the spinal unit or SCI unit in Motola in the Czech Republic, and it took several hours and got some ideas. And I have been mentioning the same information before, but now they could see with their own eyes how this care should look like. So without this cooperation, without support from the Slovak Paralympic Committee, we would never be able to manage. So the 30 million you mentioned, is it for the 4 units? It's for 4 SCI units, and also the equipment for this spinal rehab unit in Kovačova, and this neuro rehabilitation with robotics. They do have it in Czech Republic. It is no wonders. They opened new centers, and they use the funds for this robotical neuro rehabilitation. We want to be successful also here in Slovakia, and I really believe that we could manage. I try to have this vision and to set it up so it will still be really state-of-the-art in 10 years. So there is no reason to build an SCI unit we should not copy what happened in Czech Republic 20 years ago. Not the same, but we should make a new one. So